Hello and welcome to this very special vodcast for our charity of the month for January. And these guys are our charity of the month for January. They are the community first responders, and this is Emma, who's a coordinator.
Hi.
What's your official title? Is it coordinator?
I'm the community first responder coordinator, yeah.
Brilliant. And talk us through what you're going to do today in terms of the dummies.
What we're going to do is we're going to pretend that I'm demonstrating to you what we're going to be doing as a community first responder. So we're going to pretend that we're buddying and we're going together on a call. So for example, we've been called, let's say we was just watching TV or whatever, and we were on call as a first responder, and we get a call through on our phone which says that a 64-year-old male's collapsed at his home address. So we'd pick up the kit bag. I've got a training kit bag
and
here.
do you do this at your house?
Yes, but a person on call holds onto this and the phone. So this is one of the old kit bags, we've got new ones now.
Okay.
And then we're just going to come into the patient's home, and then we follow something called Dr. ABC. We teach everyone this, we teach first responders this.
Okay.
It's the same sort of protocol as what the doctors and paramedics would also follow. And Dr. ABC, so the D stands for danger. So first of all, we check the area for danger. And for a first responder, sort of things we might come across is like dogs. Even though they might be really, really friendly, you know, most of the time, when their owners collapse and they're scared, they can be a problem. So we do tend to ask for people to put the dogs away. The other things I might ask you to do is leave the door open so that we can find you, put lights on and stuff so that people know where we can get to you. And we'll come in, so we're checking for danger as we walk in. We go, hello? Hello, can you hear me? Right, so obviously we're clear of danger, no dangers nearby. So next we move on to response. Say, hello, I'm Emma, I'm the community first responder, can you hear me? Let's check for a voice response. There's no voice response, she's not responding to voice. So we just give a gentle tap. We say, hello, can you hear me? Can you hear me? No response to that either.
Okay.
So what we'll do now is we'll try and get a response to pain. And what we do is we twist the ear round. We have to do it quite firmly. Yeah, we're actually allowed to. The only
My
time
mum used to do that to me as a kid. It used to hurt. I used to fall on the floor.
So you have to do it almost like 360 degrees to try and get some sort of pain response to them. Because sometimes if you're in quite a deep unconscious state, you might still be able to respond to pain. So we'll do that on a patient. We just turn, and if there's no response to that, then we'll move on to the next bit.
Okay.
So the next bit after R is, so we've checked for response, which is the R. So we've done D for danger, R for response, and now we're going to check for the airways. So what we can do is we just open the mouth, we check there's nothing in there.
Well, like if they've choked or something.
Yeah, there might be something in there which might have choked. If there's, if they've got false teeth in or something, we leave them in if they're well fitting. So just leave them in the mouth if they're well fitting, and then we tilt the head back. The reason we do that is that when a patient goes unconscious, the muscles all your muscles relax, and the tongue is actually quite a big muscle, and it falls to the back of the throat, or it can fall to the back of the throat, and that can block the airway, and they make this snoring, sometimes make this snoring noise when that happens, or if you're unlucky, they don't make any noise at all. So if you squash your head down like that, you can feel, because with the kids we say cheesy what's it as loud as you can.
Cheesy, oh yeah, cheesy what's it, yeah.
Right, now put your head right back and say cheesy what's it.
Cheesy, yeah, cheesy
Yeah?
what's it. It's
You
like being
feel-
back in the supermarket as a kid when you used to make a noise. You put your head back and
Exactly.
shout as loud as you can.
Yeah, so what we can do is we can tilt the head back. As first responders, we've got extra equipment that we can use to help with the airways. And in here, we should have, here we go, we can insert one of these, and we can put we can measure it up, insert in one of these, and that will lay in the back of the mouth, and the tongue will lay there, so it keeps the tongue away and keeps the airway clear. So we're trained as responders, we can actually, I can't fit one into the dummy, but I can get one of those airways in to help the airways if need be. So that's what we can do for A. Next we need to do B, which is breathing. We need to check how the patient's breathing. It might be by tilting the head back, they suddenly gasp for air. But if they don't, then we tilt the head back, and then we look, listen and feel. So we look along the chest, we feel the chest, and we listen, and we can feel the breath on our cheek. We do that for 10 seconds, which if in real life is an exceptionally long time.
Yeah, it must feel like forever. 10
It's
seconds.
one. So we count for 10 seconds, and in that 10 seconds we're looking for 2 to 3 good breaths.
Okay.
In this scenario we're going to say that there was no breaths.
with the chest, are you just touching that because you want to see if it's going
I want to
down?
feel to see if I can feel any movement on there. Yes, and we listen to hear for the breaths. We're also listening for any noises. If they are breathing, we're listening for certain types of noises for certain different conditions. But in this case, we're going to say the patient wasn't breathing. If they had been breathing, the next thing we would do is we'd put them into the recovery position. I don't know if anyone remembers doing this, where you
Scouts.
Yeah,
Used to do
where
that,
you lift
Scouts,
yeah.
yeah.
Even if you can't remember exactly how to do the recovery position, just get them on their side. It's the safest place they can be. As long as their bum is higher than their head, then if they vomit, and the vomit will come away, and it will also help keep your tongue away from the back of the throat. So roll them onto their sides. Like I say, don't worry if you can't remember exactly how to do it. There isn't a proper way of doing it. But if you can roll them on their sides, just keep their airways clear. But in this case, we're going to say it's not. And now we're going to show you how to use the defibrillator. Because as a first responder, the next thing we're going to do is we're going to, if they're not breathing, even if, because some people say, well, don't you need to check for a pulse? If they're not breathing, then their heart isn't going to keep going for much longer. So as a first responder, we move straight into the defibrillator. And that's this. So if you want to open up the defibrillator, you can do that.
Wow.
In the meantime, while you're doing that, I'm going to connect up the oxygen.
This is quite scary. Because you actually feel like you come to realise that actually someone's life's in your hands.
Tear open package
Oh!
and remove pad.
Scared the life
Tear
out of me.
open package and remove pad.
Oh, I haven't
Oh,
got,
hello.
I haven't got a pocket.
Can I do
Tear
this?
open package
Right,
and
so if you
remove pad. Peel one pad from
remove the
plastic
pads.
liner.
Tear along dotted
Tear
line.
along the dotted line.
Peel
yeah.
one pad from plastic liner. Peel one pad from plastic liner. Place one
While you
pad
do
on
that, I'll
bare
just get my
upper
pocket
chest.
So peel one pad.
Place one pad on bare upper chest.
Can you make him go back? Or does he just not?
Place one
Yeah,
pad
no,
on
keep
bare
going.
upper
This is the
chest.
training one,
Peel
I've got
second
the
pad
remote control
and
now.
place on bare lower chest as
So
shown.
it's talking you through what you need to.
Peel
How do you get it
second
off?
pad and place
That's
on
it.
bare
Just
lower
put one
chest as shown.
I don't want
Do
to
not
damage it.
touch
anyway. Oh,
patient.
okay.
Analyzing rhythm.
I see what you're doing.
So if you put one,
Do
even
not
shows
touch
you on
patient.
there.
Analyzing rhythm.
So there's two of them, is it? Oh, okay. So one either.
Right, so it even shows you on there
Okay.
where they need to go.
So I'm going to put it exactly how it is on that.
Oh, there's your remote control. Yep, so perfect. Yeah, if you just
About
press.
there?
Yeah.
Lovely. And then this one goes on the
Oh,
other side,
on the
does
other
it?
side, yeah.
That scared the life out of me when they started talking at me. Right.
I'll get the air oxygen ready.
Does it matter what? If it goes the right way up, is that the right way for it?
That's fine. Lovely.
So what exactly does a defibrillator, I can't even say it properly, defibrillator do? What does it do to the body?
What it's doing is it's going to put an electric shock through the patient. Basically, what happens in a heart attack is, in certain conditions, the ones which we can actually shock the patient out of. If you can imagine, a heart attack doesn't actually necessarily stop the heart. The heart sort of does, it doesn't do its normal beat. So if you can imagine that the normal rhythm of the heart is sort of like ba-dum, 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 yeah. When in a heart attack, what happens is it sort of gets all confused. Imagine two rowers in a boat.
Yeah.
Yeah, and let's say they've had an argument and they're just rowing randomly all over the place.
Yep.
Yet the boat doesn't move, does it? Doesn't move forward. What the defibrillator does is it almost shouts at those rowers and says, right, just cut it out, you two, and just get your act together. Right, 1, 2, 3, row. Yeah, that's what a defibrillator does. So the heart's doing this because it's lost control, and what the defibrillator does is it shocks it into stopping and then starting again.
So it's almost like a reset.
Yeah, like Alt Control Delete on the computer. It just sort of says, right, no, stop, everything's going wobbly. Right, we'll put a shock through it, and we'll start again. So I stopped it because it was racing ahead of us there.
Yeah, no, it was getting a little bit extreme. Can you turn that to go back, or are you normally quite
I'm
quick with
going to
it
make
anyway?
it. In the real ones, it would know that
Tear
which
open
bit you've
package
done.
and
So,
remove pad.
so we've done the removing the pads. We've
Tear
got the
open
oxygen
package
mask
and
ready.
remove pad.
So we'll use that in a minute.
Tear open peel one pad from plastic liner. Place one pad on bare upper chest. Peel second pad and place on bare lower chest as shown.
So as you can see, it's gone and
What about if they've got like
Peel
chest hair?
second pad and
we
place
have a
on
razor.
bare lower
Shave
chest
it,
yeah.
shave it all
as
off.
shown. Do not touch patient.
Right, we don't touch the
Analyzing
patient.
rhythm.
It's analysing the rhythm of the heart. So it's trying to work out whether it's
Do
one
not
of these
touch patient.
wobbly
Analysing
heart
Oh,
rhythm.
rhythms
okay, yeah.
that so it can shock.
Shock
It's
advised.
saying it shocks advised. So what we need to do is keep the oxygen away.
Stand clear.
We say, everyone,
Flashing
stand
button
clear,
to deliver
please.
shock.
Shock in.
Stand clear. Shock delivered.